All right, so on the first segment of the program this Monday morning, we're looking at patient experience in healthcare facilities, the heart of quality care. And joining me in the studios this morning, Dr. Olamide Oluwasanmi. She's Group Head, Patient Experience for RJOLAD Hospital. Dr. Oluwasanmi, it's nice to have you in the building. Good morning.
Good morning. It's nice to be here too. Thank
you. Your first entry on the program?
Yes, please.
All right. So what do you make of our studios, by the way? Look to your left. You see the roads. What do you make of it?
It's actually very beautiful.
All right. So it's nice to have you. Let's go on and just try to do some kind of, let's do some kind of concept clarification, so to say. So what exactly is patient experience in healthcare?
It's all encompassing. These days, healthcare is not just about medicine. It's not about, coming to the hospital, taking medicine, seeing doctors. It encompasses even just when the patient has made a decision to go to a healthcare provider, the ease of booking an appointment, the ease of walking into the hospital, their interaction with, support staff, security, the front desk personnel, and even the time they see the doctor. How long does it take them to see the doctor? When they eventually see the doctor, is it a healthcare provider that actually listens to them? Takes in every complaint they have laid down, and actually listens and allays their fears. That's just what patient experience encompasses. All
right. So tell me, and talk to our listeners as well, Dr. Oluwasanmi, why is patient experience as important as the medical treatment that they get?
Because it actually builds trust in the healthcare provider. The patient actually understands that, look, if I have wonderful experience here, I can trust my doctor. It also improves health outcomes because it has built the confidence that, I trust this person. I will definitely take in the medication they have given to me, So that encourages, patients to even return and even recommend, the family and friends to the facility.
All right. So as crucial as that sounds, in terms of assessment, how would you describe the Nigerian experience for most patients in Nigeria? Is that the case? Do you have very good experience?
Well, yes. These days, with the advent of AI, a lot of patients are actually armed with information. So they know what to expect. They know that if they go to a hospital, when they speak to their doctor, they are coming in a place of knowledge, So experience has actually improved, in the health space.
So from your perspective in Nigeria, we're doing well?
Yes, we are.
So if you bring it home to your own facility, RJOLAD, how would you describe the experience for patients?
The experience is actually fantastic because we have very compassionate staff who are trained to actually listen and explain, take the time, to break down, not in medical jargons or anything, to break down exactly what is wrong with the patient. We're also actually very efficient. We have, invested in technology where patients can actually see doctors in very good time. We have processes in place. We have a good quality queue management system to ensure that patients are being moved from one care point to another in good time. We have a very comfortable environment. The ambience in the hospital is very good, which is also very important. It's actually starts the healing process. When you come into a hospital and the place is warm, the staff are warm, the ambience is nice, it improves health outcomes. We have a very robust feedback system where patients can give us can lay their complaints either, we have various feedback mechanisms, via emails. We have QR codes. They can call our call center, to give us feedback. All right. And recently we were, recognized for service excellence. We won the award for the best secondary private healthcare facility in Nigeria. Yes. Recently.
Which award is that?
It was from the Nigerian Health Excellence Awards.
Oh, great. So congratulations to RJOLAD for nudging that up. So that means part of all of that is patient experience that you guys have nudged up over the years.
Yes.
All right. So are there ways, or perhaps there a way that we can ascertain if the experience of a particular patient is good or not? What are the things that the healthcare providers, from the doctor to the nurses to the admin staff, what are those essential qualities that they must exhibit?
Also, they have to be very compassionate. They have to show empathy. They have to be able to listen, to the patients, whatever they're saying, and not come from a place of, oh, we know it all. And of course, patients need to speak up and ask questions. It's very, very important, if they don't understand something, they speak up and ask the right questions. They should also share feedback, politely, to help us improve our services. We in RJOLAD actually see feedback as a gift. We want to hear from our patients, our clients, and say, okay, look, this is what we're doing, and this is how we can this is how you can improve, the services. And of course, as a patient, you have to be open and be honest about your health history.
Right.
That would also help, in
making things better.
Yes.
All right, so Dr. Olamide, all this that you're saying makes a whole lot of sense, and it appears that could be theoretical, sometimes. When you bring it to the practical context, some doctors are not just like that. Some feel, well, like you said, they're not supposed to be an island of knowledge, knowing it all, but some doctors will exhibit that. Or perhaps some of them, they're just so, I don't know how to put it, so difficult, so to say, and every step of the way, no matter what you say, they appear to complicate the matter. So in those kind of situations, how do patients, or how should patients, relate to that kind of a doctor, and how can they, what's that word now that they normally use? How can they or blow the whistle or whistle blow this to the authorities?
Oh, like I said, feedback channels are everywhere in our hospital, from QR codes where you can scan and actually lay a complaint if you have experienced that kind of thing. But I had said earlier that we pride ourselves in having very compassionate staff that have been well trained. And honestly, in 2025, most clinicians know that patients are armed with information. They would already come to your facility and tell you that, oh, I have Googled my symptoms. They actually even give you a diagnosis. So we know that this kind of things happen, and we do not come off as being, you can't speak to us and everything. We let you speak, and then we listen and advise.
Right. Okay, so let's talk about how does patient experience impact healthcare outcomes and satisfaction, so to say. How does it impact that?
Like I said, you would always get good clinical outcomes because the patient actually trusts what their doctor is saying. The support staff is also very important. I remember one time a patient had said, oh, I love everything you people have done in your hospital, in some other facility, and then, oh, the food, was just the icing on the cake for me. And I can say to you that our meal service is actually one of the best. Patients actually love our meal service. So it is an all-encompassing thing when it comes to patient experience. I wasn't expecting the patient to talk about meal when they come to the hospital. Oh, but they do, because the food actually matters. Food is actually a drug. It helps. You can imagine if patients are in the hospital and there's some medication that you can't even take without food, and the food is not palatable. You probably will not want to take the medication.
Right. So let's look at some common challenges that patients face in healthcare facilities. Does any one of them come to mind?
Usually wait time could be one of the biggest challenges, not being able to see a doctor on time. And of course, we all know about this, brain drain that's been happening, the Japa syndrome, where some doctors are not available.
Right.
So those are one of the pain challenges. But we have tried to actually even navigate that by, ensuring that we have clinicians available, a range of specialists.
You mean it?
Yes.
At RJOLAD?
Yes.
So what's your ratio to patient, your doctor to patient ratio?
So we usually have, 5 to 8 patients to a doctor.
To a doctor?
Yes.
Wow. You mean it? That means you guys are really doing well in that regard.
We are.
Okay. So I'm just thinking now. So in a situation whereby you have some downtime, a doctor not around, perhaps the doctor has too many patients to see, how could health facilities manage that kind of situation where you have so many people who are waiting to see the doctor and the available doctor at that particular time is not accessible, so to say? So how should health facilities manage that?
So that's where our support staff come in, where, they would have to speak to the patients in a very compassionate way and explain to them. Because one of the things that probably would aggrieve people is the fact that they're not given information. They don't know why they're waiting, endlessly. So we pride ourselves in making sure that we're communicating, at every step of the way to let them know, okay, there's going to be a delay. You're going to be waiting for another 10 to 15 minutes, before your doctor comes in.
All right.
So we've been able to navigate that.
All of that. Lagos Traffic Radio 96.1 FM. Patients' experience in healthcare facilities, the heart of quality care, is our focus this morning. Dr. Olamide Oluwasanmi is here. She's Group Head Patient Experience for RJOLAD Hospital, and that's our focus. Very, very shortly, I'll allow you to also join the conversation. But getting back to the roads, we did tell you that there's a fallen articulated vehicle just by the ramp. If you're coming in from the that's the Jota end heading towards the interchange. It's a slow one this morning. As a result of that, container, I understand, is blocking the entire ramp. All right, the Olowu end presently, I understand we're having high influx from Adekunle intersection inwards Adeniji, Sura, or Balinde Bridge down to CMS Bridge. Slow and steady. That's the name of the game at this time. CMS Bridge descending towards UBA is busy for now. Outer Marina inwards State House down to Officers Mess, very busy also. And we can tell you State House linking up with Ilubirin, Simpson down to the 3rd Mainland Bridge. Very, very good to go if you are making that journey. So that's what you have at the moment. Those of you around the Lagos Abeokuta Expressway, it's also looking good. If you're coming in from the Dokpamu end, linking up with Cement, still looking relatively good. But approaching Ilezik, things begin to slow down. It's a merging point for those of you coming in from the Yanokwaja end, and those of you coming in from this Sule, that's Agege Motor Road. Slow and steady, that's the name of the game. From there through Ikeja Long down to National, where 4 lanes begin to thin out into 2 lanes, you have it very, very slow. Beyond that point towards Airport U-turn, looking much better. Bolade down to Oshodi is also looking good. Victoria Island, we can tell you Mekwan Bridge connecting Bonny Camp roundabout moving, but of course we have a backlog proceeding towards Flag House as a result of high influx, early morning rush as well. Bonny Camp inwards Mekwan Bridge looks pretty good to go at the moment. And then we can tell you traffic inwards Bonny Camp, that's if coming from Amadu Bilaway, is moving just as expected. You must be expecting some delays approaching the mobile fuel station due to dispensing. And then we have Eco Hotel looking pretty good. A little bit of delays approaching the roundabout, coupled with traffic light delays, but no major worries driving through those corridors. Let's get back to the conversation right now, Dr. Olamide. Let's reflect a bit on the patient themselves, really, because all we've been talking about is what the health facilities can provide and what they should be doing at every point in time. But from the perspective of the patients themselves, what do you think they can do, to also contribute to improving their experience as well? What do you think patients should be doing?
Also, they should come on time when they have an appointment. They should speak up and ask questions when they are not sure of whatever the doctor has said. They should always ask questions. They should be honest about their health history, which is very key because it would help in managing, their health care.
All right. So they should be very honest. They should speak up, like you said. But you have patients who could be very, very difficult, right?
Yes.
Sometimes.
Yes.
So how do you handle such kind of patients as a medical practitioner?
Well, with the training comes all of this. You would always have difficult people. It's just to allay, their fears, their anxiety. And just speak to them and let them understand that you're doing all of this in their best interest.
Okay. All right, so that is on, but you've just given us your own experience. I need you to just talk to our listeners this morning. One particular story that really, really changed the perspective of a particular patient in terms of the experience. Does anyone come to mind?
Okay, so there's a particular experience that I remember. A father had called me, about their child wanting to come to the hospital. He had gone to several facilities and they weren't getting, the care that they wanted. It was about a child that had been born with a congenital anomaly and had gone to several facilities. So he called me and I literally held his hand throughout from, them. They were outside of Lagos,
right.
Booking the flight, and telling them as soon as you get into Lagos, let me know. Had alerted the clinical team to be on standby waiting, and from all the stages of him, even before getting to the hospital, the father was really amazed that he can't imagine that when he was literally handheld all through the process. And thank God, I mean, the surgery was a success, and they were better off for it, and they were very, very happy.
All right. So a happy ending it was. All right. So that sounds pretty good. But in other instances, the experience might be a bit nasty. If you have cranky nurses, or perhaps a doctor who has not been off duty for 2-3 days, the reaction, or perhaps some kind of irritation that will come from that medical personnel could be very, very. His reaction might not be very pleasant, so to say. So, for a hospital like RJOLAD, how do you handle that kind of a situation for that kind of a medical practitioner?
So usually, we ensure that people get the adequate rest. So you wouldn't have somebody working over extended hours and get to the point of where, they get cranky and get upset with our patient. One of our key values as an organization is empathy. And we do not encourage, our staff, being cranky towards patients and the likes. Because like I said, patient experience is very big for us. Very, very big. We're a patient-centric organization, and our patients are our main focus. So when it gets to the point that, somebody is a bit tired, that person would definitely be relieved and have somebody else step in their place. And if a situation is getting out of hand where we have patients are getting upset, then supervisors or security can come in and step to kind of diffuse, the situation.
Now, is this the experience in all your hospitals or just at the headquarters that you're talking about?
No, but in every facility we could have situations where you have cranky patients, and of course that is managed across all facilities because that's the process in place. Right.
So where do we have RJOLAD in Lagos?
So we have our facilities in Bagada, we have in Agege, we have in Isolo. We also have where our spokes in Bariga, in Jara Mall, Ikeja, and then in Penn Cinema.
All right, so that's about 5 different locations?
Yes, please.
All right, some reactions coming in for you. By the way, if you want to join the conversation, feel free, and that will be on 09153877127 09153877127. This one says, good morning, Victor. Doctor, how is patient experience different from just treating someone's illness? You didn't put your name, but thank you so much. So how is that different?
I'm sorry, I didn't get that.
It says, good morning, doctor. Say, how is patient experience different from just treating someone's illness?
Like I said, patient experience is the whole encompassing journey of a patient. It starts from you booking an appointment to the point where you see a doctor and get discharged. It's the whole journey of the patient. It's not just about getting treated by the doctor. It's the journey that starts from you booking an appointment, walking through the doors, seeing a doctor, and stepping out.
All right. So it's one thing for the doctor to diagnose, right? Treat. By the time it gets to other supporting staff of the hospital, what happens in those regards? I mean, in the areas of dispensing of drugs and all of that, what happens?
For the pharmacists, they're, like I said, they're also trained in being respectful, being empathetic, and explaining, with dignity to patients exactly what their medication is all about. It's like I said, it's the whole journey. Every single care point understands that the experience of the patient depends on them. So whether you're even a janitor, whether you're a support staff, you're in the catering department, you're the front desk, you're admin, you are all part of the patient experience journey.
And is there a way the authorities in RJOLAD, for instance, is there a way if one of this team is not performing optimally in terms of rendering good patient experience?
Oh yes, like I said, every time a patient comes into our facility, we give a survey. We administer a survey, so you can give us feedback on every single touch point, that you have experienced. You can even put down names of either staffs that have delighted you or otherwise. So we actually, go through that. Like I said, we have multiple feedback channels, and we delve into them seriously. We take them very, very, very seriously. All
right. We'll find out if you've gotten any kind of recommendations from any staff on a particular person that are doing pretty well. This one says, good morning, Victor and Dr. Oluwasanmi. Happy New Week. Please, do doctors actually get trained on how to talk to patients? Sukomi from Ilasa. Sukomi, thank you so much. So is there any training like that?
Yes, actually, we do a lot of training, especially even in our facility. I sometimes facilitate such trainings, where we ensure that customer experience is key. Emotional intelligence, how you speak to patients, how you address them, bedside manners. We do a lot of training on that.
All right, then 08099120770, You can share your experience with us. If you visited a health facility for any kind of treatment, what did you get at the end of it all? How was the experience? You can share that with us on the program as it moves on. All right, do not forget, those of you around the Ojota end heading towards the interchange, by the ramp there's a fallen container, or perhaps a container that fell off a truck, which is blocking that ramp. So it's making your movement towards K2 a little bit difficult. All right, but the traffic managers are there to also guide you and help you as you navigate along. All right, 08099120777. This one says, good morning. In my opinion, there's a communication gap between Nigerian doctors and patients. Patients. It says complain about lack of patients complain about lack of communication. So, say Dr. Oluwasanmi, how can hospitals do better in explaining test results and treatment? Thanks, Shehu Ibrahim. He said it that morning. Shehu Ibrahim is one of our regulars on this program. Thank you so much.
Thank you for that question. And honestly, that's one of the biggest challenges that we have in healthcare communication. Sometimes patients feel like, their doctors are not getting across to them, in a timely fashion. And not even explaining in lay terms what it is. So, of course, that is something that it's being worked on, I guess, in almost all facilities. But I'll bring it home to our facility, that in our RJOLAD hospital, where we break down these things for the patients. We communicate with them in a timely fashion and actually, explain it to them. And if they don't understand, we're happy to explain all over it.
Let's talk about the jargons now. the jargons. How are you guys dealing with that? And of course, the handwriting. A lot of times when doctors write, you need a soothsayer to help you interpret it.
Fortunately now, most times prescriptions are done either typed out and everything, and we usually don't even need to write these days anymore. So
no more ambiguities.
Yes.
Or no more hiding of those writings, because sometimes I think in the past it was just to prevent some kind of abuse, right?
I don't think so. I think it's more like the person just has a bad handwriting.
Yeah.
Well, I don't have a bad handwriting, so.
Because sometimes when you say 7/2, it is.
No. So that actually is just trying to explain. Well, it's not 7/2, but then it's usually just to explain, and it's between. That's why it's between clinical staff. You're taking a prescription, maybe to the pharmacy, and it's just explaining how many days or how long the duration, that you're supposed to use a particular medication. It's not, but then it is explained by the pharmacist to you in clear terms.
Because they feel like they are already communicating with the pharmacist, not you at that point. It's just for you to take it down, right?
Yes.
This one says, good morning. Okay, in my opinion, I think we've taken that. 08099120777. This one says, many Nigerian nurses, especially the ones in the public sector, needs to be taught empathy. You didn't put your name, but thank you so much. Is that correct?
Well,
that's the assessment, really. That's the assessment. People feel that most doctors in the public sector, most of the general hospitals, or maybe they need much more in terms of empathy.
I'm not sure. I wouldn't want us to
generalize.
Make a blanket statement about that. But I know that a lot of work is being done, improving services even in our public institutions.
Let's bring it to the care for women. When we talk about deliveries and all of that, people have always talked about nurses lacking empathy. I mean, talking to the women, you're not the first. Shay, Nicole, are you the first? I mean, we've had so many women that have gone through this. They were very strong. How come you are? So how should that be handled?
Oh, of course, it's with empathy as always, because whether we are not the first person to go through labor or whatever does not take away the fact that that person is in some form of discomfort. And of course, you need to always, as a healthcare professional, show empathy and be respectful to the patient at all times.
All right, then 09153877127. Gradually winding down towards the end of the program. This one says, Doctor, do you think better patient experience can actually save lives? Miriam from Arikbu is sending this one in.
Oh, definitely, most definitely. I mean, like I said, it builds trust. Once a patient feels at home in a hospital, feels happy, trusts their clinicians, it will definitely improve health outcomes.
All right, let's begin to round this all up right now, Doctor. So what's the message this morning? What would you be, telling those who are listening to us this week? What's the message?
So for us at RJOLAD, we believe healing begins with how you're treated, not just the medicine you receive. So I just want us to say that, you should visit us today and experience healthcare where you truly matter.
That's what they should do. Yes. And for those who want to connect with RJOLAD Hospital, how can they do that?
So you can either visit our facilities that I said earlier, or you can visit www.rjolad.com. Or you can send an email to wecare@rjolad.com. You can also reach us on 07 000 756523.
We'll leave it at that for now. It's nice having you in the building. Thank you so much for being here.
Thank you.
All right.
My pleasure.
Okay, so patients' experience in health facilities, the heart of quality care, has been our focus. And Dr. Olamide Oluwasanmi, Group Head, Patient Experience for RJOLAD Hospital, has taken us on this excursion. I'm going to take a short break. When we return, the program continues.